If you leak urine with laughing, coughing, sneezing, and exercise, then you may have something called stress urinary incontinence. Believe it or not, 1 in 2 women will have some form of urinary leakage. It's definitely more common than you think, and we do not talk about it often enough. So today we're going to learn about stress urinary incontinence together. Hello everyone, and welcome back to the channel. I'm Dr. Nabila Noor, a board-certified urogynecologist and a pelvic reconstructive surgeon. Now, every time I'm in clinic, at least half my patients will have some form of urinary leakage. And these could be women in their 20s, maybe they just had their first baby and they're starting to get back to their regular routine, starting to exercise, and every time they're doing their aerobics class or their spin class, they notice some wetness in their underwear. Or it could be somebody, in their 50s and 60s who maybe previously they've had isolated episodes of leakage of urine, and now after menopause, they're noticing it almost every day to the point that they have to start wearing a panty liner all the time. Or it could be patients who are or women in their 80s who maybe for the last 10, 20, even longer years been suffering from urinary leakage, but always been told that, don't worry, this is normal for aging. You guys have heard me say this multiple times. While age is a risk factor, it's definitely not normal to leak urine at any point in your life. So why does stress urinary incontinence happen? Or actually, even before that, what is stress urinary incontinence? So stress urinary incontinence is loss of urine or urinary leakage due to any kind of activities that can put pressure over your bladder. Now, the bladder is located in the lower abdomen, so any kind of activity, whether it be exercise, laughing, coughing, sneezing, bearing down, lifting heavy weights, that puts pressure on your bladder, makes you leak. So then the next question is, why does it happen? Well, there are 2 big theories that we talk about all the time. Number 1 is because of lack of the support structures for your bladder and the urethra. The bladder is the organ that holds our urine, and the urethra is the pipe through which urine comes out, and the 2 are connected. So these organs are supported by something called pelvic floor muscles, which essentially forms the base of our torso. Now, these pelvic floor muscles can weaken because of things like age or risk factors like age, menopause, pregnancies, trauma from childbirth, especially if you've had any kind of operative delivery, such as usage of forceps. It could be, because you're on the heavier side, because obesity is a risk factor. Smoking, because it can affect the tissue quality. Sometimes it's genetics. I hear this all the time. My mom had it, my grandmother had leakage, and now I have urinary leakage. So that's one reason why women have stress incontinence. The other reason is because of damage to the sphincter muscles around the urethra. So remember, the urethra is the pipe through which urine comes out. There are these muscles around the urethra known as the sphincter muscles that helps close it. But these muscles can be damaged with things like prior pelvic surgeries, radiation, nerve damage to those sphincter muscles, and that can cause those sphincter to not work well, which means they're not helping close the urethra. So that could be another reason why leakage happens. The good news is there are lots of good treatment options to help women suffering from stress incontinence. And these treatment options can be conservative, which are non-surgical, or they could be surgical. And these surgeries are what we call minimally invasive surgeries, which means they're all same-day procedures that could be done with tiny incisions and sometimes no incisions at all, and patients go home the same day and they do amazingly well. So non-surgical treatment options can be something like doing pelvic floor exercises with the pelvic floor therapist, who can guide you to learn how to strengthen your pelvic floor muscles to help support your pelvic organs, or in this case, the bladder and the urethra better. There's also something called a pessary, which is a vaginal insert that we can insert into the patient's vagina that helps support the bladder and the urethra, and that can be helpful in treating stress incontinence as well. With regards to surgery, 2 of the most common surgeries that I talk to my patients all the time. Number 1 is what we call a sling procedure, where we make a tiny incisions through the vagina under the urethra and pass a piece of mesh, which helps support the urethra like a little hammock. And that helps provide the support that the urethra is missing. It's a quick surgery. It's done, it's a same-day surgery. Patients go home the same day. It has really changed how we treat women with stress incontinence. It's definitely one of the best options that we have with regards to surgery, and provides the best long-term outcome. There's something else that we call a bulking injection, which is almost like, cosmetic fillers that people use to bulk up their cheeks or their lips. So same idea. So the urethra has a lining. So we inject these fillers into the walls of the urethra, which thickens them and then narrows the actual hole through which urine comes out. And that can help with prevent leakage as well. So if you are somebody who's suffering from stress urinary incontinence, then please don't suffer any longer. Talk to your primary care doctor, talk to your OBGYN, have them refer you to a urogynecologist so you can discuss these options with them and come up with a plan that works for your lifestyle. If you have somebody who is your loved one who's suffering from this, please share this video so that they can learn from it and then get the help that they need. If you found this video helpful, as always, please put it in the comment section and don't forget to subscribe to the channel. Thank you for watching. I hope to see you next time. Bye!